At 67 years old, Mr. Ahmed walked into my clinic terrified. Not because of cancer, not because of heart disease, but because he whispered, "Doctor, I think I broke something down there." What shocked him, and what may shock you, is that the damage didn't come from an accident, a partner, or old age. It came from one habit he thought was completely safe. If you're over 60 and you still masturbate or plan to, this video could save your health, your confidence, and your manhood. Please don't scroll away. As men move past the age of 60, their bodies change in quiet but important ways, especially when it comes to blood flow, nerve sensitivity, and tissue resilience. One of the most overlooked realities is that the penis is not the same organ it was at 30 or 40. The spongy erectile tissue becomes less elastic, tiny blood vessels narrow more easily, and nerves that once recovered quickly from pressure or friction now take longer to heal. When an older man continues using excessive grip strength or aggressive motion during masturbation, he may unknowingly begin a slow process of damage that doesn't announce itself with sudden pain or injury. Instead, it works silently in the background, gradually reducing sexual function over time. Excessive pressure compresses the delicate nerves that carry sensation from the penis to the brain. These nerves are responsible for pleasure, arousal, and the reflexes involved in erection and ejaculation. When they are repeatedly squeezed too tightly, their ability to transmit signals weakens. At first, this may feel like nothing at all, or it may show up as a need for stronger stimulation to reach climax. Over months or years, however, the brain starts receiving duller signals, which translates into reduced sensitivity and less satisfying sexual response. Many men mistakenly believe this loss of feeling is simply normal aging, when in reality it is often aggravated by mechanical stress that could have been avoided. Blood flow is affected in a similar way. Erections depend on healthy circulation, with blood flowing freely into the penile chambers and staying there long enough to maintain firmness. Aggressive squeezing can temporarily block this flow, and repeated episodes of restricted circulation can irritate blood vessel walls. In older men, whose vessels are already less flexible, this can contribute to weaker erections, difficulty maintaining firmness, or erections that fade quickly. Because this process is gradual, men often respond by gripping harder in an attempt to compensate, unintentionally creating a harmful cycle that worsens the underlying problem. Another important factor is tissue microinjury. Strong pressure and forceful motion can cause tiny tears in the erectile tissue that are too small to notice. In younger men, these heal quickly and completely. After 60, healing is slower, and repeated microinjuries may heal imperfectly, leading to subtle scarring. Over time, this scarring can reduce elasticity, making erections feel less full or less responsive. Again, the danger lies in the silence of the damage. There is rarely a dramatic moment when something goes wrong, only a gradual decline that seems mysterious and frustrating. Psychologically, this physical change can deeply affect confidence. When erections become weaker or sensation decreases, many men internalize it as a loss of masculinity or vitality. Stress and anxiety then further interfere with sexual function, compounding the physical effects. What began as a mechanical habit becomes a source of emotional strain, even though the original cause may have been something as simple as using too much force. A short example illustrates this clearly. A 65-year-old man notices that his erections are not as firm as they once were, so he starts gripping more tightly during masturbation to make it work. For a while, this seems effective. Months later, he realizes that sensation feels duller, and climax takes longer. He tightens his grip even more, believing effort is the solution. A year later, he struggles to maintain erections at all and feels numbness he never had before. Nothing dramatic ever happened, yet the cumulative effect of excessive pressure slowly undermined his nerve sensitivity and blood flow. The key message is not fear, but awareness. Masturbation itself is not harmful at any age, but after 60, it requires a gentler, more mindful approach. The penis responds better to care than to force. By reducing grip strength, slowing movements, and respecting the body's changing limits, older men can protect their nerves, preserve circulation, and maintain healthier sexual function for years to come. What you do repeatedly, even in private and without pain, shapes your future sexual health far more than most men realize. As men move beyond the age of 60, One of the most important yet least understood changes in sexual health is recovery time. The body simply does not rebound the way it once did. Nerves take longer to reset, blood vessels need more time to respond fully, and the prostate becomes more sensitive to repeated stimulation. When masturbation happens too frequently during this stage of life, especially with the intention of checking or testing erection strength, it can quietly interfere with the very function a man is trying to protect. Sexual stimulation places real physiological demands on the body. Each erection requires coordinated nerve signaling, adequate blood flow, hormonal balance, and muscular relaxation in the pelvic floor. After orgasm, the nervous system enters a recovery phase where sensitivity, blood flow dynamics, and neurotransmitters need time to normalize. In younger men, this refractory period is short. After 60, it naturally lengthens. When stimulation occurs again before the body has fully recovered, nerves can become overstimulated and less responsive, much like a muscle that is exercised daily without rest. Instead of becoming stronger, it becomes fatigued. Frequent masturbation can also place repeated stress on the prostate gland. The prostate tends to enlarge with age and is more prone to inflammation. Excessive ejaculation without adequate rest may irritate the gland, contributing to subtle pelvic discomfort, a feeling of pressure, or changes in urinary habits. Many men don't immediately connect these sensations to sexual frequency, so the cycle continues unnoticed. Over time, this low-grade irritation can negatively affect sexual comfort and performance. Another critical issue is how frequency interacts with anxiety. Many older men become hyper-aware of erections as they age. A slightly weaker erection or a missed morning erection can trigger worry, leading to repeated masturbation sessions intended to prove that everything still works. Unfortunately, this mindset turns sexual activity into a performance test rather than a natural response. The nervous system begins to associate arousal with stress and evaluation, which interferes with the relaxed state required for strong erections. The result is often poorer performance, which then fuels more testing and more anxiety. There is also an impact on erection quality itself. Erections depend not just on blood entering the penis, but on the ability of smooth muscle tissue to relax and trap that blood effectively. Repeated stimulation without sufficient recovery can lead to erections that start but fade quickly, feel less firm, or require more effort to maintain. This is not because the body is failing permanently, but because it is being asked to perform again before it has restored its baseline function. Sleep and hormone balance play a role as well. Testosterone levels naturally decline with age and are closely tied to rest and recovery. Overstimulation, especially late at night, can disrupt sleep patterns and further reduce hormonal support for sexual function. Over time, this contributes to lower libido, reduced energy, and diminished sexual confidence, creating a cycle that feels discouraging but is often reversible with healthier habits. A short example helps illustrate this clearly. A 68-year-old man notices that his erections feel slightly less firm than they did a few years ago. Concerned, he begins masturbating daily, sometimes more than once, to reassure himself that he can still perform. At first, he feels relieved, but within months he notices that erections seem weaker, not stronger, and he experiences a dull ache in his pelvic area. His anxiety increases, so he continues the habit. When he eventually reduces frequency and allows several days of rest between stimulation, sensation, and firmness gradually improve. The problem was not aging alone, but insufficient recovery. The key understanding is that sexual health after 60 follows the same principle as overall physical health. Rest is not a sign of weakness, but a requirement for function. Masturbation does not need to be eliminated, but it does need to be approached with patience and respect for the body's slower rhythm. Allowing time between sessions gives nerves a chance to regain sensitivity, blood vessels time to respond fully, and the prostate time to settle. When frequency is balanced with recovery, sexual function is more stable, confidence improves, and anxiety loses its grip. What feels like doing more to protect performance often achieves the opposite, while doing less, more thoughtfully, often restores what men fear they are losing. As men age, the body becomes less forgiving of stress and injury, and this is especially true for delicate structures like the penis. One of the most dangerous mistakes men over 60 make is ignoring warning signs such as pain, tingling, numbness, or changes in shape, assuming these symptoms are simply part of getting older. In reality, these signals are the body's way of asking for attention and care. When they are dismissed or pushed aside, small problems can quietly grow into long-term injuries that affect sexual function, confidence, and quality of life. Pain during or after masturbation is never something to normalize. While mild soreness can occasionally happen, recurring discomfort indicates irritation or injury to tissues that are already more vulnerable with age. The penile nerves, blood vessels, and connective tissues lose elasticity and heal more slowly after 60. When masturbation is rough, rushed, or performed with excessive force, it can create tiny internal injuries known as microtraumas. These injuries may not cause immediate or severe pain, but repeated over time, they prevent proper healing and begin to alter the structure of the tissue itself. Numbness or tingling is another critical warning sign. Sensation depends on healthy nerve signaling, and when nerves are repeatedly compressed, overstretched, or irritated, they can become less responsive. Initially, numbness may come and go, often disappearing after rest. This temporary relief can be misleading, encouraging men to continue the same habits. Over time, however, nerve sensitivity may decline permanently, leading to reduced pleasure, difficulty reaching orgasm, or a sense of emotional distance from sexual experiences. Many men assume this loss of sensation is unavoidable aging, when in fact it is often the result of unaddressed nerve stress. Curvature or bending of the penis, especially when it is new or worsening, should never be ignored. While mild curvature can be natural, sudden changes often signal the formation of scar tissue inside the penis. This scar tissue develops as the body's response to repeated micro-injuries that do not heal properly. Over months or years, the scar tissue becomes firmer and less flexible than healthy erectile tissue, causing the penis to bend during erection and sometimes making erections painful or unstable. This condition can interfere with sexual activity and significantly impact self-esteem if left untreated. The danger lies in how quietly these problems develop. There is rarely a single moment of injury that forces immediate action. Instead, symptoms appear gradually and are easy to rationalize or hide. Embarrassment plays a role as well. Many older men feel uncomfortable discussing sexual symptoms, even with a doctor, and choose silence instead. Unfortunately, silence allows damage to progress. Early intervention, even simple changes in technique or frequency, can prevent long-term consequences, but only if warning signs are taken seriously. Emotionally, ignoring these symptoms can be just as harmful as the physical damage itself. As pain increases or sensation decreases, frustration and anxiety often follow. Men may push themselves harder in an attempt to fix the problem, unintentionally worsening the underlying injury. Over time, this can lead to avoidance of intimacy, strained relationships, and a loss of sexual confidence that extends far beyond the physical issue. A short example illustrates this clearly. A 70-year-old man notices mild pain on one side of his penis after masturbation. It's not severe, so he ignores it, assuming it's just age. Months later, he begins to feel a slight bend during erections and occasional sharp discomfort. Embarrassed, he still avoids seeking help. A year later, the curvature is pronounced, erections are painful, and sexual activity has become stressful rather than enjoyable. What began as a small warning sign could have been addressed early, but ignoring it allowed scar tissue to form and limit his sexual health. The key understanding is that aging does not eliminate the body's ability to heal, but it does demand greater respect for its signals. Pain, numbness, and curvature are not punishments for aging, they are messages. Listening to those messages, slowing down, adjusting habits, and seeking medical advice when needed can preserve sexual function and prevent long-term injury. Protecting sexual health after 60 is less about endurance or force and more about awareness, patience, and self-care. When men respond early to what their bodies are telling them, they often find that comfort, confidence, and function can be maintained far longer than they ever expected. As men age, sexual function becomes increasingly dependent on the brain rather than sheer physical responsiveness. While hormones, blood flow, and nerve health still matter, arousal after 60 is heavily influenced by how the brain has been trained to respond to stimulation over time. This is where frequent reliance on pornography can quietly create problems. Porn-driven stimulation exposes the brain to unnaturally intense, fast-changing, and highly novel visual cues that are far removed from real-life intimacy. Over years, especially in later life, the brain adapts to these artificial triggers and begins to expect them in order to feel aroused. The human brain is remarkably adaptable, but this adaptability works both ways. When exposed repeatedly to high-intensity visual sexual content, the brain releases large amounts of dopamine, the chemical responsible for motivation and pleasure. With frequent exposure, the brain gradually reduces its sensitivity to dopamine, requiring stronger or more novel stimulation to achieve the same level of arousal. This process is known as desensitization. In younger men, the brain often compensates more easily. After 60, however, neurological flexibility declines, and the effects of desensitization become more noticeable and persistent. As a result, normal sexual cues, such as touch, smell, emotional closeness, or slow physical intimacy, may no longer generate the same excitement they once did. This does not mean attraction is gone or that love is absent. It means the brain has been conditioned to associate arousal with exaggerated stimuli that real life cannot replicate. Many men are confused by this shift because they may still be able to achieve erections during masturbation with porn, yet struggle to do so with a real partner. They often assume the problem is purely physical, when in fact the issue lies in neural conditioning. Another important factor is attention and pacing. Pornography trains the brain to expect constant novelty and rapid stimulation. Scenes change quickly, bodies are idealized, and arousal is immediate. Real intimacy is slower, more subtle, and emotionally layered. For an aging brain accustomed to instant stimulation, this slower pace can feel underwhelming, leading to distraction, loss of focus, and difficulty maintaining arousal. Over time, the brain learns to disengage during real encounters, even when desire is present. This conditioning also affects emotional intimacy. Sexual arousal in long-term relationships often relies on trust, vulnerability, and emotional connection. Porn bypasses these elements entirely, reinforcing a pattern of arousal without emotional involvement. As this pattern strengthens, some men find it harder to feel sexually connected during real intimacy. They may feel mentally distant, pressured, or disconnected, which further interferes with erection quality and satisfaction. Importantly, this is not a moral issue or a sign of weakness. It is a neurological response to repeated stimulation. The aging brain is not broken. It is simply responding to what it has been trained to expect. The danger lies in not recognizing this connection. Many men respond by consuming more porn, believing it will wake things up. But this often deepens the conditioning and widens the gap between artificial and real arousal. A short example illustrates this clearly. A 66-year-old man in good physical health notices that erections with his partner have become unreliable, yet he has no trouble masturbating while watching porn. Confused and embarrassed, he assumes his body is failing him. Over time, intimacy becomes stressful, and he begins avoiding it altogether. When he reduces porn use and allows his brain to reconnect arousal with touch, closeness, and slower stimulation, his response with his partner gradually improves. The issue was not physical decline, but learned neurological expectation. The encouraging truth is that the brain can be retrained. Reducing or eliminating porn, slowing down sexual stimulation, and focusing on sensation rather than visuals allows dopamine sensitivity to normalize over time. This process does not happen overnight, especially after years of conditioning, but many men experience significant improvement when they give their brains the chance to reset. Real intimacy begins to feel engaging again, erections become more reliable, and anxiety around performance diminishes. After 60, sexual health is less about intensity and more about connection, both physical and mental. Protecting the brain's natural arousal pathways is just as important as protecting blood vessels or nerves. When stimulation is balanced, realistic, and emotionally grounded, the aging brain can continue to support satisfying sexual experiences. What feels like a loss of desire or function is often not loss at all, but a signal that the brain is asking to be retrained towards something more natural, sustainable, and deeply fulfilling. As men pass the age of 60, sexual health becomes less about intensity and more about awareness. The body is still capable of pleasure and responsiveness, but it operates under different rules than it did decades earlier. Nerves are more sensitive to overload, blood vessels are less elastic, and tissues take longer to recover from stress. In this stage of life, gentle technique and mindful habits are not restrictions, they are protections. Treating masturbation as a health-aware activity rather than a stress outlet or performance test can make the difference between preserving sexual function and slowly undermining it. Gentle technique starts with understanding that force does not create better results. Excessive pressure, fast repetitive motion, or prolonged stimulation may seem helpful in the moment, but over time they strain nerves and restrict healthy blood flow. A lighter touch allows nerves to remain responsive and reduces the risk of desensitization. It also supports better communication between the brain and the body, which is essential for erections and orgasm. Many older men are surprised to find that when they slow down and reduce pressure, pleasure actually improves rather than diminishes. Lubrication plays a crucial role as well. Aging skin loses natural moisture and elasticity, making friction more damaging than it once was. Dry stimulation increases the risk of irritation, inflammation, and micro-injuries that heal slowly after 60. Using adequate lubrication reduces friction, protects sensitive tissue, and allows smoother movement with less strain. This simple habit can significantly reduce discomfort and long-term tissue stress, yet it is often overlooked. Mindful frequency is another key element. Masturbation does not need to be frequent to be healthy. In fact, spacing sessions farther apart allows nerves and blood vessels to fully recover. When masturbation becomes a daily routine driven by boredom, stress, or anxiety about performance, it can quietly exhaust the system. Treating it instead as an occasional, intentional activity helps maintain sensitivity and prevents the nervous system from becoming overstimulated. Rest is not a sign of decline, it is a requirement for sustained function. Equally important is the mental approach. Many older men unconsciously turn masturbation into a test of masculinity or sexual ability. They check erection firmness, duration, or response time, often comparing themselves to their younger years. This mindset introduces pressure and anxiety, which directly interfere with arousal and enjoyment. When masturbation is approached mindfully, without judgment, urgency, or comparison, it becomes a supportive experience rather than a stressful one. The nervous system responds best to calm, relaxed stimulation, not evaluation or self-criticism. Attention to recovery is often ignored but deeply important. After sexual stimulation, the body needs time to reset. This includes physical rest as well as mental relaxation. Staying hydrated, sleeping well, and avoiding immediate repeated stimulation help the nervous system regain balance. Over time, men who respect recovery notice more consistent erections, better sensation, and less pelvic discomfort. These benefits are not dramatic overnight changes, but steady improvements that accumulate with healthier habits. Mindful masturbation also encourages awareness of the body's signals. Gentle habits make it easier to notice early warning signs such as discomfort, fatigue, or reduced sensitivity. When men are attentive rather than forceful, they are more likely to stop, rest, or adjust before harm occurs. This awareness protects long-term sexual health and reduces the risk of chronic issues that arise from ignoring subtle signals. A short example illustrates this clearly. A 72-year-old man notices that his erections feel weaker and climax takes longer. Believing effort is the solution, he masturbates more frequently and with more force. Over time, sensation dulls and confidence drops. Eventually, he decides to change his approach. He reduces frequency, uses lubrication, slows his movements, and focuses on relaxation rather than performance. Within a few months, sensitivity improves and erections become more reliable. Nothing medical changed, only his habits did. The deeper lesson is that sexual health after 60 is maintained through care, not pressure.